I look at where we are, and the pregnant global reality is Brazil is failing and maybe India is failing as well. Should America be worried about the transfer of their pandemic over to us?
I definitely think that if a pandemic is raging in one part of the globe, the other parts of the globe still have to take notice. I think we'll do well in the United States with our vaccine rollout and put the pandemic largely behind us, but it will still be going on in many other countries. And that's going to be disruptive because that's going to have restrictions on travel, restrictions on trade. And the goal is to get this pandemic behind for the whole world. So we do have to take issue with what's going on in Brazil and India and try and make sure that they can get access to vaccines, because that's the ultimate solution. And I think it's going to be well into 2022 before the entire globe is free from COVID being a public health emergency.
That's right where I wanted to go. I think this is so important. Dr. Adalja, what is your timeline where the United Kingdom and the United States can aggressively assist third world countries, emerging market countries, with their struggles with this pandemic? Did I just hear you say it is out into next year?
It's definitely going to be something where we still have hotspots around the globe in 2022. There are the Bill and Melinda Gates Foundation. There is the COVAX program, which are trying to get vaccine into those countries that are resource constrained, but it's going to take some time. If you go back to H1N1 in 2009, that hit Africa longer than it did most of the developed world because they had poor access to vaccines. So this is going to be something we have to contend with for some time, and it's going to affect the way you can travel, the way you can conduct commerce, and you're going to see those hospitals and some of those places still worrying about surges when this is something that's largely not confined to the US, UK, Israel, or any other highly vaccinated country.
Well, this morning we're seeing European stocks rise to record highs. I don't think it's a coincidence that it comes after an internal memo is reported from the European Union saying that that region would meet some sort of 55% threshold of vaccinations for its people, or at least have enough vaccine for that by the end of June, excuse me. This seems a lot sooner than possible. I know you probably have no care at all about the markets, but is it realistic that we could get 55% of the population covered when it comes to vaccine supplies in Europe by the end of June?
It's in the realm of possibility. It's going to be challenging. The EU has been very slow to start with the vaccine, and they've had multiple hiccups with the AstraZeneca vaccine, which is making it much harder for them to get vaccine into people's arms. I do think that supply will get better to the EU with all of the other vaccines as well as the AstraZeneca vaccine, so they can do it if they move aggressively. But I would not be surprised if they miss that deadline. Hopefully they hit it, because the faster they get vaccinated, the faster it is for the rest, the better it is for the rest of the world and for them.
What's the deal with the AstraZeneca vaccine? Is it safe? Why has it been such a controversial vaccine?
It's hard to explain. There have been some initial concerns about studies where they were using a half dose and a full dose formulation, which they couldn't understand, and that kind of set them back in the United States. And then a few trial pauses for transverse myelitis, which is a spinal cord inflammation that occurred, which wasn't linked to the vaccine. And then you saw this bigger pause because of blood clots, and that's still being worked out. For most, my general analysis is still the same, that this is a very rare complication, if it is at all linked to this vaccine. And when you're dealing with a pandemic that is out of control, the risk-benefit ratio, even if there's this small chance of blood clots, still favors the vaccine. And we haven't seen that kind of data from the UK, where they're using AstraZeneca as one of the pillars of their pandemic response. But all of that trickles down to how does the general public think about the AstraZeneca vaccine? And then we had this mix-up at with the plant in Baltimore. All of that really just translates to people saying, well, maybe I should get a different vaccine because this one has had all these problems. It's not fair to the AstraZeneca vaccine. However, that's the reality of vaccine hesitancy. And I think that's playing a major role in the way the EU has handled this vaccine. And it's something hopefully they'll be able to sort out and fix. And I think we will eventually get the AstraZeneca vaccine approved in the US. But with all of these bad headlines, it's going to add up in the average person's mind.
Dr. Adalja, there's 4,000 some bodies that saw the Boston Red Sox last night do it to Tampa Bay. I don't know what the Pittsburgh Pirates were doing. I'm going to assume 4,000 people in a stands of 40,000, something like that. In Texas, there were 38,238 people to watch the Texas Rangers. Your thoughts?
It's very difficult to have a mass gathering like this with only maybe less than 20% of your population vaccinated, which is the case in Texas. And they put mitigation measures in place with masks, but you wonder, just because of how the prevalence of the disease in the community, if this is going to lead to transmission events and even super spreader events, and put contact tracers underwater because they've got so many cases to track. I think that this was, this was something that I think is not necessarily the safest way to go about this. Hopefully, it turns out okay. Texas has had a good trajectory in terms of cases and hospitalizations. We don't want them to go to backslide. But again, mass gatherings are going to be something particularly difficult to have until we get more of the population vaccinated, or you only have vaccinated people at your mass gathering event, and that clearly wasn't the case there. So I am worried about what this will lead to in terms of chains of transmission.